With our next speaker, Dr. Naga Nischal, who's the clinical head and the emergency head of Cloud9 Hospitals Group, Bangalore. And sir is also president of Karnataka State SEMI, and he's also part of exam board of SEMI, and he has mentored almost 65 plus students in emergency medicine, and he is a passionate teacher and a mentor too. Over to you, sir, for presenting on use of VR and simulation.
Hi, thanks, Abdul. Thanks, Kaho. Thanks, National Board SEMI, for giving me this opportunity. While there have been wonderful talks for, today afternoon, I've been given something exotic. So I'm going to speak about virtual reality and simulation and how they affect the training in emergency. So first and foremost, whenever we challenge what is a conventional way of treatment or training, first thing we should know is what's wrong with that. While we know that all of us or most of us have been trained in a traditional way of learning, you take a patient, you have your senior, you have the patient in front of you, and we have learned most of the things bedside. Correct? Or at best a mannequin, and you are put in a room with all the resources and you're taught. So what is wrong with these traditional methods that we are now looking towards virtual reality, simulation, and other newer methods? Let's look at it for a minute. The first and foremost is looking at the manpower intense method of training. We all know while we need a lot of manpower, we don't have. So any manpower that is used to train is taking them away from the job. So at this point, we don't have that luxury. Traditional methods require a lot of manpower, which we don't have it handy. Second, they're high risk. So when you're trying to teach your student, your junior, with the patient in front of you, the stakes are high for the patient, right? You want to teach him a procedure, you want to teach him how to do a thing, you want to teach him how to communicate to a patient. It is high risk. Error are going to be high. The third most important thing is this is going to be time consuming. And we all know time is a finite source that all of us have. It's not going to be available infinitely. Fourth, very, very important is high cost. When I say high cost, it is about the need of a huge infrastructure, bed, people, gadgets, ventilators to teach. It's not easily available because you need them for your patient care, and that's going to cost a lot. The last but the most important is while we have all moved from attention span era to a very, very low attention span era. So none of them would love to sit for hours and learn. We want to keep our things crisp so that you learn and move on. And we all would like to do this in a different way so that your attention span is contained. So what do we do? Traditional methods are not working. So do we change it? Let's look at the options that we have. I think the first thing that we need to realize is that should we replace them? The question is, what can we do with both? Before we go, what do you all understand with simulation and VR? Simulation is maintaining the environment that you learn, having all the things that you do with the patient care, but with no patient. You're literally using a mannequin, a plastic mannequin, or a model to learn. Virtual reality is nothing but using a software where you are wearing, like you see on the picture, the lady is wearing a VR handle, and then you are literally in an environment which is recreated for you. It is immersive because it's recreated for you specifically. I just want you to see and look at the small short video.
Okay, real-time communication with the patient team, which is super fun. We've got, and you saw in that first video, there were 4 students all working together. The same thing happens here. This is, I'll blow this up a little bit. But
There
we've
you
got
go.
4 different students all working together on the same patient. They're running a code training and they're giving medication. Somebody's recording, somebody's going to use the defibrillator and intubate, etc. Right? So it's a little bit more immersive. You're able to work in teams. And then, you know, lastly, we're trying to make this much more affordable. I'm sure a lot of you are familiar with the cost that it takes to.
So I don't want to take the entire time to show this, but we all know how important it is that we, sorry for that, it's not going ahead. There you go. So a virtual reality is exactly what you saw now. You can recreate any environment, have one person, 4 people, 5 people, recreate the environment, recreate the situation, a case scenario, and practice. First and foremost, what are the biggest pros of a virtual reality training is the transition from not knowing anything to knowing is a very smooth, because you can't harm the patient here. You have the flexibility to go wrong. You are at a very, very low stake environment, right? Importantly here, you have the luxury to pause, talk about your teamwork and communication, and correct then and there, which in a real-time scenario or in a simulation scenario may take you much more time. What evidence has shown is that by doing a virtual reality training, you can recruit your medical professionals faster and in fact keep the training going and hence retain better. This is the flexibility. You can put any patient condition or environment. And more importantly, it is very consistent. You design the scenario, you design the solutions, and it is very easy for you to assess and also give feedback for your students who are learning. The basic architecture of a VR in a medical training has 3 aspects. You have a web administration portal, which is pretty much for the IT. Your most important thing is your data, your editing module, and you have your database made, done by the doctors, worked along with an IT professional, and all these are clinical professionals working with an IT professional so that you can simulate a near virtual emergency room. While we spoke all the big stuff, we all want to know how it pans out in our emergency rooms, right? Here is the scenario. So this, just look at your screens, and I'm sure all of us do a quality check on how good our code training is, right? How is your staff ACLS knowledge? How is your code training? Just look at the screen and see this is a scenario made and projected on your VR goggles. You are going to look at this patient and tell all your team members what you should be doing, whether it is time to response, whether it is quality of chest compression, whether it is the steps, whether it is your safety. So here it becomes easy to replicate a common scenario and you can assess and look at the quality. Triaging accuracy. When you're teaching triaging, especially in a disaster scenario, it is quite intimidating for people to learn how to triage. The margin of error is very minimal. You don't want them to learn when there is a disaster. So this is a perfect example how you can learn where your scenarios are simulated. You can go wrong here, go back to the scenario, come back and do and relearn. Very, very common and very, very important quality indicator is your door to needle in times of your stroke. All of you know we don't want to mess around here. We want our quality indicators for stroke very well because we know it's an irreversible damage. Put a scenario of a stroke, look how you assess, look how long you take, what are the steps you take, how you are going to ensure you shift the patient to the right departments, get them back, and you make a decision when you want to thrombolize. So all this is simulated, and you can always redo it as many times as possible until you learn. This is the same thing for a door to balloon for your STEMIs. And again, this will also give you a feel of the exact scenario. You're shifting the patient to the cath lab, you're calling people, you're documenting stuff, you're looking at the ECG. So a VR gives you a very real life scenario that you can better your quality indicators. So what does the evidence say? So of course, most of the evidences, as you see, say that the people who have learned and the people who have trained or teaching on VR, both of them feel the teaching is effective, more effective. And in fact, in one of the studies, they say that almost 82% of the participants said that I learn better now, I can retain better, hence I'll be a better nurse, hence I'll be a better doctor. And if you see the 2023 study, your most adverse events happen because of communication error. Whereas you're looking at VR as a solution, these are the few studies that have happened in 2020-21, where it has been proven that the communication, the coordination, and the training of the teams, and even the performance of the Code Blue teams have gotten better after they've practiced on a virtual reality training. Not only that, even the procedural skills. You're looking to intubate. You want to see what are the pitfalls. You want to see the assessment of your intubation. What is your RSA protocol? You are going to do this with no patient on a virtual reality so that nobody is harmed. You can make any attempts you want, and you develop the muscle of safety, muscle of the technique. The same thing, like I was saying, it is not just used to train people. The VR training is used to even retain people and definitely improve the performance of teams, especially the code teams, the trauma teams, where they need to work in large teams, coordinate, and get their act together. All is good, but do you think it's expensive? So will VR replace the traditional bedside? So we shouldn't do traditional, we just do a VR. Just look at the table there. All good things come with a cost, right? So what we are currently doing also costs money. We need beds, we need hospital, we need a place, we need doctors, nurses, and you have look at the amount of money it's needed. So traditional methods may require $80,000 to $90,000. You need a lot of ongoing costs. You have consumables, and the advantage of a traditional method is it's time proven. And many of the hospitals may already have this. So what's the problem with VR? VR comes with a huge initial cost, almost twice the cost of your traditional methods. It needs a software updates, timely updates. But the advantage is you can scale it. You can teach 1, 10, 100,000 people in a very, very short time. Most importantly, you have data where you can go back and learn. And importantly, like we saw in COVID, you can teach anybody sitting anywhere. This is the flexibility that VR gives. And like you can see the last line, the VR simulation in emergency definitely has a potential for a long-term saving. When it improves the quality, when it improves the training knowledge of the person, helps in reducing errors, and helps in retaining your staff, the investment that you do is going to last long. So I think the increased cost versus the advantages in the long term justify. So what? Do we replace? This has been a classical method. I don't know how you guys called for a taxi before. 10, 15 years ago, you would stand in the road, call out for a taxi, wait patiently, bargain with them, and get on. But I don't think most of us do this anymore, right? It's on your phone. Use technology and you get to where you have to go. So when the world is moving tech, why healthcare should not use? So what do you think is the best way forward? The best way forward is, like you look at the picture there, your foundation of knowledge still can happen the traditional way. The VR simulation is not to replace, whereas simulation and virtual reality can act as a catalyst to improve quality of training in ER. They will speeden up the learning curve of your young staff or even your existing staff to ensure they learn faster. It literally goes back to the adage that you fail fast, right? Whereas you can't fail fast in a traditional learning because it's time consuming. The second important point is the sound knowledge. The core knowledge, what you need for training, is still has to be read, has to be learned, has to be known by the patient. So, for example, if you want to intubate using a virtual reality, you still need to know how to hold the blade, correct? Because seeing on a virtual reality will help you to develop certain skills, but it does not or it may not fully develop a skill. How do you hold the blade? So you will need to know how to hold the blade, but you will use the knowledge you have gained out of the virtual reality. How do you position? How do you use? I think perhaps the most important role of a virtual reality training is the amount of time you spend in learning on real patients. Imagine the days where we would have patients and we would try procedures on them, learn on them. And we spend so much time on so many patients, where virtual reality can reduce that time you spend to learn a skill. If I needed 10 intubations to become proficient, then virtual reality can perhaps bring it down to half of it. So that's time saved, that's less risk to the patient, less adverse events, and your patient is safer, you're happier.
So your last 2 minutes.
I'm done, man.
Yeah, thank you.
So these are all my references, and I'm sure in any references that we put, definitely my references also would be ChatGPT, including all these references that you see. Thank you for your virtual attention. While you gave the virtual attention, I'm sure you all would want to know the traditional way of talking to each other, which I'm sure we're going to have a panel after this where we can exchange our ideas and thoughts. Thank you. Thank you for your patient listening.
Thank you so much, sir, for taking us through virtual mode of your knowledge and expertise. So we will be moving ahead. I'm sure all participants are really, really happy to have this particular enormous learning session. It's a really a knowledgeable marathon what we're trying to have. And going